Dr. Ghatan, I'd like to talk about a particular skin problem. I know a friend of mine when I was very, very small-headed, about 9, 12 years old, and he was, frankly, he was shunned by most people, and I have to admit, even I had a definitely hard time looking at it. Basically, his skin was, well, it wasn't like normal skin, it was like white, and spotty, very, very spotty, sometimes very red, sometimes very white, different spots. I think Michael Jackson had a similar problem like that, maybe. Can you shed some light on it? What is it called? Where does it come from? What can one do for it?
Yes. What you're describing basically fits the definition of vitiligo. Vitiligo is basically a loss of pigmentation in the skin, a total loss of melanocytes, which are the pigment-producing cells in the skin. It is a cosmetic concern, but it also has a lot of emotional components to that, and people are ashamed, and they seek help to get rid of this problem. It does have some significance in terms of medical significance. If there is an extensive vitiligo, there are other what we call autoimmune diseases that could be associated with it, such as diabetes or some other autoimmune diseases. So we would do some testing, some screening, maybe to find out if there's any other concern that has to be addressed. There are many different treatments for vitiligo, and unfortunately people at times become very desperate and try all kinds of lotions and potions they could get over the internet or otherwise, and a lot of them are not properly tested or regulated, and could be harmful. The best treatment at this time really is laser treatment, which is totally painless and very effective. It requires twice or maybe 3 times a week treatment in office, and it may take a few months, but we do see excellent results with it, and that's the best way to go. In the past, they have used a pill called Sorolin, and then the patient takes the pill and then comes to the office and get exposure to a UV, ultraviolet light, and that is kind of a treatment that would take about a year and a half.
Wow.
To take effect. And patient needs to be checked out because the Sorolin could have effects on the eyes and other things, and needed to be watched closely. But anyway, laser now is really the gold standard, I would say, of the treatment for vitiligo. There are creams, there are steroid creams and non-steroidal creams that are also being used. Sometimes they can be used in conjunction with the laser. Also, intralesional, what we call, meaning that we give shots into areas where there's a pigment loss, and they are quite effective as well. There is another procedure that's done. It's basically skin transplant. You take skin from one area, graft it to the area where you have the pigment loss, and you get pigment there. And that's a bit more drastic, and not everyone wants to go through a surgical procedure to do that. But luckily, the laser is now the best thing for vitiligo, and it's effective.
And once you do that laser treatment, is it going to stay? Meaning, number one, how much of it do you think, so to say, goes away and yet still stays visible? And how long does it last once you do the treatment?
It depends on what part of the body it is. Some parts of the body are more resistant to treatment. Some parts respond much faster. Once it's treated, most of the time it may not come back the same spot. It could come back somewhere else. More of the time, it doesn't come back where it was treated before. Again, the success rate varies from person to person. There are different kinds of vitiligo. There's a kind of vitiligo called segmental vitiligo. What that means, it follows a line. It's a linear vitiligo, and that one is a bit more difficult to treat. But otherwise, the general vitiligo is quite responsive to the treatment.
Wonderful. Well, thank you very much, Dr. Ghatan. It's good news for lots of people who might want to get rid of some unwanted white, red spots or whatever it may be. Thank you very much.